be a proponent of a single-payer universal health care plan. But as all of you know, we may not get there immediately, because first we've got to take back the White House, and we've got to take back the Senate.
So what I've said is, let's set up a system where if you already have health care through your employer and you're happy with it, you don't have to change doctors, you don't have to change plans, nothing changes. If you don't have health care, or you're highly unsatisfied with your health care, then let's give you choices, let's give you an options, including a public plan that you could enroll in and sign up for. That's been my proposal.
A plan that was shopped around to all the Democratic candidates by a Yale University political science professor named Jacob Hacker.
While I think the insurance industry will be very opposed in total, I do think that we shouldn't forget that there's going to be a divide, as there was in the early 90s, between large and small insurers over the best course forward. This would eliminate, I think, the small group market insurance industry, right? It's premised on doing so.
And next to me was a guy from the insurance company who then argued against the public health insurance option, saying it wouldn't let private insurance compete, that a public option will put the private insurance industry out of business and leave single payer. My single payer friends, he was right. The man was right.
Someone once said to me, this is a Trojan horse for a single payer. And I said, well, it's not a Trojan horse, right? It's just right there. I'm telling you, we're going to get there. Over time, slowly, but we'll move away from reliance on employment-based health insurance, as we should, but we'll do it in a way that we're not going to frighten people into thinking they're going to lose their private insurance. We're going to give them a choice of public and private insurance when they're in the pool, and we're going to let them keep their private employment-based insurance if their employer continues to provide it.
But I don't think we're going to be able to eliminate employer coverage immediately. There's going to be potentially some transition process. I can envision a decade out, or 15 years out, or 20 years out, where we've got a much more portable system.
One of the virtues of it, though, is that you can at least make the claim that there's a competitive system between the public and private sectors.
This is not a principled fight. This is a fight about strategy for getting there, and I believe we will.
Let's have an honest debate. We can agree on that.